Occupational asthma. I'm going to be going through basically what asthma is, generally, what occupational asthma is, so the difference between regular asthma and occupational asthma. Then I'm going to be talking about how you control and prevent occupational asthma, as well as what the importance of an early diagnosis is and why you would want to find out early. Who gets occupational asthma? I'm also going to be going through a little example of 3 sectors where occupational asthma is prevalent. I'm going to be talking about how you can protect yourself, so what you can do, as well as what you can do and what you should do if you suspect that you have occupational asthma. So since we're talking about asthma as a respiratory disease, I thought I'd like to talk about a little bit about just what the lungs are, the function, as well as a little bit about the anatomy of it. So a common analogy about the lungs is it's an upside-down tree. You have the trachea, which is like the trunk of the tree, and that's the main branch going down your throat. And then that branches out into 2 bronchi, which go into the right lung and the left lung. These bronchi then branch off into bronchioles, which are smaller, which then branch out into terminal bronchioles and alveoli. And here is just a schematic diagram of alveoli. They're little sacs, basically, and that's where gas exchange occurs. The main function of the lungs is to bring in oxygen into the body and take out carbon dioxide. So your body needs oxygen basically for metabolism, and it produces carbon dioxide, which you have to get rid of somehow. So this occurs in the alveoli, which have really thin membranes, and it allows the air to get in really close contact with the bloodstream, and that's where oxygen goes into the bloodstream and carbon dioxide is diffused out and goes into the alveoli so that it can then be brought back out and breathed out, which is what happens when you exhale. This is just a diagram of an X-ray, and or a picture of an X-ray, and it shows the 2 lungs, which are black because air shows up black in X-rays, and the heart is solid, so it turns out white. If you can see right here, that's the outline of the diaphragm, and that's the muscle that you contract when you breathe in, and it draws air into the lungs. And when you exhale, that muscle actually relaxes and air is pushed back out into the open, in the atmosphere. So what is asthma? Asthma is basically characterized by 4 main characteristics. One is wheezing, so if someone has an asthmatic attack, you'll hear them having this really characteristic wheezing sound, type of like sort of sound. I can't really imitate it, but you'll definitely hear it. And it kind of, to me, sounds like a cartoon character. Shortness of breath as well, so they'll have difficulty breathing. They often cough, and they'll feel a tightness in their chest. Now, not every asthmatic will have all these symptoms, but they'll have at least one. Asthma is also a worldwide condition. It affects people from all parts of the world, every country, every race, male or female, young or old, and approximately 300 million people in the world are affected with asthma. Back home in Canada, 5 to 10% of Canadian adults are affected, and 20% of Canadian children. So this is just a schematic diagram of what happens during an asthmatic attack and what's the difference between a regular bronchiole and an asthmatic bronchiole. As you can see, in a normal bronchiole, you have a pretty wide airway. Inside, there's plenty of room for air to flow. And in an asthmatic bronchiole, there's constriction. This is significantly smaller than this, and there's also inflammation, so the actual airway is a lot more reduced than the regular airway. So normally air moves freely through the airways, but with asthma there's inflammation, like I just said, and constriction. So in inflammation, airways become irritated and they're red and they're swollen. Tissues become inflamed, and mucus is secreted. Mucus is usually secreted to trap any particles that get into your lungs and the cilia move the mucus out of the lungs, so you can either swallow it into your esophagus or cough it out. But however, when you have asthma and you have an asthmatic attack, a lot of mucus is secreted. It's stickier and it's also more viscous, so you actually, instead of moving the irritants out of your system, you're blocking your airway, so no air can get in, you're not coughing anything, well, you're trying to cough stuff out, but it's not really working that well. So your whole mechanism is hypersensitive and hyperreactive. And as with constriction, your muscles around the airways, right here, the little bands of muscles, constrict and they tighten. So all of these factors together means that you have difficulty breathing, you're coughing, it causes all the symptoms of asthmatic attacks. So there are two types of asthma. The first type is immunological, and it's allergy-induced. And that's a more common type. A lot of people don't really know that asthma is actually an allergy-induced disease. So most people don't get asthma right away, they get asthma after a while of being exposed. And I'll explain a little bit more about that later. Non-immunological asthma is irritant-induced. And what this means is that it usually doesn't occur after a latent period. It usually occurs right away, 48 hours after your exposure, and is usually to a high concentration excuse me, of a substance. So something like a chemical spill would be an irritant-induced asthma. So immunological asthma, what happens is that it's an immune response to an allergen, and an allergen is basically a substance that causes allergies. So that could be almost anything. Like Dr. Hellier said, there are 260 substances in occupational asthma that can cause asthma. And in asthma, there's probably even more. And so allergens first enter the lungs and they activate an immune response. So the first time this happens, nothing really happens, you're not going to have an asthmatic attack. But with each exposure, the lungs become more sensitized to the allergen. And there's a whole immunological complex that happens. It's similar to a bee sting. You don't get allergies right from the first bee sting. You get it after at least one bee sting. So with each exposure, the lungs become more sensitized to the allergen. And eventually, there's just a cutoff point, and you're exposed to the allergen, but instead of just a little uncomfortable kind of a feeling, you get a large allergic response, and you get an asthmatic attack. So this whole process is called sensitization. And this is a more common type of asthma. It's usually an allergy that's induced. Non-immunological asthma well, it doesn't happen as often. It's irritant-induced and sometimes referred to as reactive airways dysfunction syndrome, or RADS. And it's usually after a single or several exposures to irritants in high concentrations. Like I said, something like a chemical spill could induce this type of asthma. So a lot of things can cause asthma, and 4 common ones are something like pollen, which is kind of like organic dust that you breathe in. It's irritating, you become allergic to it. Dust mites are small little insects that you can breathe in. Mites are important or common allergens. Cockroaches even, I've read, are allergens as well. Mold and bacteria, when you breathe in, a lot of mold and bacteria are small enough that you can breathe in, it goes into your alveoli. That also can cause problems for many people. And dander meaning urine or feces of animals, animal saliva, which contain proteins that people are allergic to, and that's why people are allergic to pets and that kind of thing. So what's occupational asthma? What's the difference between asthma and occupational asthma? Well, in occupational asthma, it's caused by something that you're exposed to in the workplace. So it usually occurs after a significant time exposure, like 1.5 years to 5 years type of an exposure. Could be even longer, and it could be shorter. So if you were exposed to an irritant type asthma and you were exposed to a large chemical spill, then that could actually be a lot shorter. And an important thing about occupational asthma, which is probably why we're giving this talk, is that it's something that people can recover from. And that's really important. If you remove the exposure, you can recover, not always, but you'll probably get better anyways, but you possibly could recover from it. So symptoms in occupational asthma usually get worse over the day and the work week. And if you work a regular Monday to Friday, 9 to 5 type thing, then it improves during the weekends or vacation. So when you're not working, it improves and you can breathe better. So like this little puppy over here, you can breathe when you're on vacation. So how do you control occupational asthma once you have it? Well, there are drugs, and basically occupational asthma has the same symptoms as asthma. So you want to be able to bronchodilate and dilate the bronchioles so that you can breathe again. It's really important to do so when you have an asthmatic attack because you don't want the bronchioles to stay constricted. Otherwise, the airways where the bronchioles constricted, anything after that won't get air or oxygen. And tissues after even just a few minutes can die, so you really want to be able to breathe really quickly and use bronchodilators. The most important thing probably is to stop exposure because you don't want your breathing problems to become permanent. If you don't stop the exposure and you stay basically asthmatic, your lung tissues can become permanently deformed and then it's not reversible anymore, so you can't get better. And in that case, treatment would become continuously needed. So we don't want that. Another thing that you can do to control it is if you can't stop the exposure, then try to minimize the exposure. So wear dust masks and with respirators to help control the exposure. And these have to be properly fitted and well maintained. It's really important to have it properly fitted and fit tested because if you don't have a good seal around your nose or your mouth, there's really no point in wearing your respirator. You can still breathe in the substance that's causing the asthma, and you're actually just making it more uncomfortable for you to work. So it's really important to have it fit tested and make sure that there's a really good seal. Another thing that you can do, which is basically the same sort of thing as stopping the exposure, is to relocate or maybe change areas where you're working, move to a different area where you're not exposed to the substance, and that will result in less of an exposure. And that's just a dust respirator mask. It's a N95 mask, and that's an example of a bronchodilator. So how do you prevent occupational asthma? Well, you can replace dangerous substances with less harmful substances. So if you know what can cause asthma, and if you know that it's hazardous and it's irritating to you, then ask your employer or just even yourself, try to replace it with something that isn't as harmful. And you probably have to do a little research about what it is, because there's so many substances that can cause asthma. You can also minimize your exposure with engineering controls like ventilation and enclosure. So if you can't replace the substance, you can draw the air out and bring in fresh air so you don't breathe in the substance at least, or minimize breathing in the substance. You can also enclose the process which exposes the workers to the chemical or the dust or whatever, and this would also help with exposures. An important thing is to educate workers. You want to be educated so you know what can affect you and what can cause asthma. You also want to be able to be a little more careful, so you have proper handling, you avoid spills, and you know what just being careless could lead to. So that's really important to be educated. Okay, so why do you want to have an early diagnosis? I touched a little bit about this before. You want to prevent the worsening of occupational asthma. It's also reversible if the worker is removed from the damaging substance, which is really important. And if you're diagnosed early, you can prevent your coworkers from getting sick as well because you're raising awareness. They know that there's something hazardous in the workplace. And people will take precautionary measures. You could also maybe replace the substance with something else. So you're actually not just saving yourself, but other people as well. So who gets occupational asthma? Not everybody that works in the same place doing the exact same thing is going to get occupational asthma. There are genetic factors that come into play to determine whether you're more prone to getting asthma. Something that will tip you off is if you have allergies. If you're more prone to getting allergies, you're immunologically more prone to have factors such as antibodies or specific antibodies like IgE that cause you to have allergies, and this would lead to asthma eventually if you're not careful. Another thing that you can control is smoking, and smoking for a lot of substances is kind of an exacerbating kind of factor. So it's not an addition factor, it's kind of even a multiplication factor. So for example, if say dust increases your chance of getting asthma by 5 times, and smoking increases your chance of getting asthma by 10 times, if you put them together and you smoke and you're exposed to dust in the workplace, you don't increase your chance by 15 times, but say like 30 times or 50 times. Like it just multiplies. So that's a really important factor to take into consideration. If you're exposed in the workplace, don't smoke. It's just not good. And so I'm going to give you an example of 3 sectors where occupational asthma is prevalent. You have the agriculture sector, leading to agricultural asthma. You have auto body repair shops, where asthma is prevalent as well, and nail salons. So, agricultural asthma. A lot of people think that you work in a farm and you have fresh air and everything and it's all great and you're not going to get sick, but actually it's not the case, and I'll tell you why. Farmers and farm workers are exposed to a wide variety of stimuli which can cause asthma and aggravate existing asthma. And I forgot to mention before that whether you get asthma from your occupation or whether you had asthma before that got better and then it got worse during while you were working, it's still occupational asthma. In agricultural asthma, it's usually immunological or allergy-induced. And some common stimuli are dust, insects and pesticides, bacteria, molds, and animal products and fertilizers. So the frequency of occupational asthma isn't static across all the farmers. It's about 20-30% for hog farmers, 5-10% for poultry farmers, and 4-7% for dairy farmers. Now, I'm not really sure what this discrepancy is, like the reason for it. It could be because they use different types of feed. Maybe hog farmers use a feed that causes more allergies. Maybe pigs excrete more feces. I don't know. But there is a discrepancy, there is a difference. And actual numbers may be far higher since this disease is underreported. So dust in an agricultural setting is found everywhere. If you ever walked into a silo and you tried breathing, you would know that you would start coughing right away. It's basically made up of grain, hay, or straw, and it's usually not visible unless under strong light. So if people are used to it, they don't really notice it. But if you see right here, these are 2 pictures of exactly the same thing. One is probably with the barn door closed and one with the barn door open. And as you can see, with normal lighting, you don't really notice anything. You can't see the dust. You don't really worry about it. But under strong lighting, it's like a foggy haze. So it's quite dangerous. Another thing that farmers are exposed to are insects and pesticides. Mites are tiny and they're aeroallergens. There are 3 types of mites that are prevalent in an agricultural setting. You have storage mites, found where anything is stored, so silos are a big thing, haystacks, that type of thing. Red spider mites are found in orchards and greenhouses, and dust mites are found wherever dust is found. So we're exposed to dust mites as well, not just farmers. This is just a picture of spider mites. See, they're tiny. Okay, so pesticides are another thing that can aggravate asthma. Usually the consensus is, though, that pesticides aren't strong enough to induce asthma by themselves, but they can exacerbate asthma. So it's usually pesticides along with something else like smoking or dust or what have you. Bacteria and fungi are small, so you can breathe them in, basically. And the total number of bacteria as well as the type of bacteria will determine how much damage is done to your lungs. Many products are found in bacteria and fungi that can cause asthma, and these are usually located in the cell walls of bacteria, and a lot of people are allergic to these. So examples are endotoxins and glucans. Animal products and fertilizers are obviously present in an agricultural setting. You have animal saliva, urine, and feces, which contain proteins that can be allergens for many people. Ammonia is also a gas that's produced from animal products, and it's the most common gas to exceed permissible exposure values in animal housings. High levels of ammonia can cause nausea and headaches. It can cause occupational asthma, and it's found in fertilizers, which isn't too surprising since we all know that animal products are used as fertilizers. So asthma and auto body repair. In auto body repair, spray painting is a huge hazard. You spray paint, the droplets of paint are suspended in the air. They're tiny, you can breathe them in. They're also suspended for a longer period of time because they're sprayed, so it's easier for you to breathe them in. And there's also an increased risk for eye exposure as well. So why do you care? What's in paint? Well, isocyanates are found in paint, and isocyanates are known to cause asthma. They are severe irritants to the upper and lower respiratory tract. And what they're used for in paint is basically to harden paint. And it's also actually used in foam and automotive body parts. Isocyanates, like I said, can lead to sensitization and later asthma. And what you can do if you work in any of these industries, like anything that uses paint or foam or body parts, is to ask for material safety data sheets, which will tell you whether you have isocyanates in whatever you're working with, and also it'll tell you any chemicals that are in whatever you're working with and what hazards are associated with those chemicals. So inhalation exposure to isocyanates causes cough, sore throat, chest pain, and shortness of breath. They are also skin and eye irritants, and this is just a picture of someone with a really big rash. And it can lead to a decline in lung function without obvious symptoms. Now, anything actually can lead to a decline in lung function without obvious symptoms, which is the dangerous part. Because if you don't know that you're getting sick and you don't have obvious asthmatic attacks right away, then your decline in lung function will occur so much that by the time you can't walk up the stairs without getting winded, it's too late. So that's why it's really important to prevent your exposures and not just be like, okay, well, I have an asthmatic attack, I'm going to start taking care of myself now. So you don't want to be the unlucky one that doesn't feel anything until it's too late. And that's why you need to protect yourself. There are basically 5 big things that you can do to protect yourself. That's eliminate the exposure, remove any hazardous substances that you're exposed to, substitute it with something that's less hazardous, control your exposures by using ventilation or enclosures, protect yourself with protective equipment like respirators and dust masks, and consult an occupational professional so you know what you're exposed to, what's hazardous, what's really hazardous and what's not really, and what you can do to protect yourself. And protective equipment that people use in isocyanate exposure would be air purifying respirators with pre-filters mounted with cartridges for organic solvents, and splash goggles to prevent everything getting into your eye. So asthma and nail salons. Many products are used during manicures and pedicures, and depending on the treatment, exposure and health risks vary amongst cosmetologists. A big thing in nail salons is dust from nail filing and chemicals from nail polish and nail adhesives. Dust can be basically emitted from buffing or sculpting real nails, and a big thing in nail salons is artificial nails. The dust that they produce from artificial nails actually contain methacrylins, which are known to cause asthma. So it's not just dust that's irritating; you're also ingesting a chemical, and it's irritating when it's breathed in. Therefore, dust masks should be used to reduce inhalation, and because it could cause occupational asthma, and as well, it can get into the eye, so safety glasses could be used. When you apply nail polish, you have 3 coats. You have a base coat, the nail polish coat, and the top coat. And every time you apply it, you wait for it to dry. And when it's drying, it's basically hardening, and the chemicals are actually, the solvents are going from from liquids to gas, so it's volatilizing. And once it's a gas, you can breathe it in. And the harmful chemicals in that is formaldehyde, methacrylates, and these can cause occupational asthma. So a dust mask really actually wouldn't help in this case. But what you could do is use downdraft tables where wind is pulled down and away from the worker. So it's ventilation, basically. You have air going, fresh air coming towards you and bad air moving out. In nail adhesive, acrylic glue contain ethyl methacrylates or other related methacrylates. So again, harmful chemicals, you don't want to breathe them in, can cause occupational asthma. So how do you protect yourself? First and foremost, wear dust respirator masks. They're easy to wear, and you just put them on, and they're cheap as well. Another thing that you can do is wipe down to avoid dust from becoming airborne whenever possible. And air purifying respirators could be used, which would protect yourself from the chemicals as well. Like I said, eye protection goggles, proper ventilation. This is a diagram of a downdraft table where fresh air is moving in, or well, actually, bad air is moving in here, and it's drawn out to the outside. Also, what you could do is substitute harmful substances with less harmful substances, although it's more difficult in the nail industry because most things contain harmful chemicals. So what you could do in all of these sectors, or any sectors that you work in, is medical surveillance. What this includes is pre-employment and pre-exposure medical questionnaires. Spirometry, which is what this guy is doing right here, it can be done periodically throughout the period of employment. And what spirometry does is basically test your lung function. So it tests how much air you can breathe in, it tests how fast you can breathe out, which would basically check for any airway obstruction and any indication of maybe asthma occurring. It's also important to have health education, and pulmonary function tests every 2 years, as well as chest x-rays may be required. So that's another chest x-ray, the same one. So what can you do if you suspect that you have occupational asthma? Well, you can seek medical attention, you can get treatment, so it's really important, like I said, to open the airways and help breathing during an asthmatic attack. As well, it's important to remove the occupational exposure to the substance causing the asthma, and like I said before, this is really important. It often will lead to reversal of the disease, or it'll at least make it better. So for more information, these are some of the websites that you can go to, and that's the end of my presentation.